Hi, this is Miles here with my patient Jay Lavallee. Jay is one of my ski racing athletes, and he just came into the clinic today complaining of a few signs and symptoms. We're going to take a look at him. So Jay, what's going on, man? How you feeling?
Good. We just traveled out to Colorado to do our preseason skiing, and we just got back, and I just feel wicked out of it. My head really hurts. I have a big headache. I feel like I'm gonna get sick, and I'm just super tired. But when I try to sleep, because I'm so tired, I just can't. I just feel weak, and I think because I'm so tired, it almost feels like I'm hallucinating a little bit. I just feel really out of it. My vision's kind of blurry too. The weird thing is I didn't even hit my head or anything, and
Okay.
my heart's been beating pretty fast.
Okay. You feel like you're going to throw up at all? Any nausea involved with it as well?
Mm-hmm.
Okay. And today was your first day on snow, is that correct?
First day on snow.
Okay, alright, sounds good. And we're pretty high up here, so altitude might be a factor. Have you been hydrating enough, do you think?
Not really. I just kind of been drinking average amount, which usually isn't enough.
Okay. And this is pretty much, this is one of the higher altitudes that you've been to, is that correct?
Yeah, I think this is the highest I've ever been to.
Okay, alright, sounds good. So I'm going to check out a few things today, alright, Jay?
Mm-hmm.
First thing I want to check out is I want to listen to your heart sounds, okay? So if you could remove your shirt for me, that'd be great. So here I'm worried about pulmonary edema with the signs and symptoms he's presenting with. Looking at his skin right now, it looks like he has a little bit of a bluish hue, a bluish or purplish hue to his skin, possibly hinting at cyanosis. He stated that he's having trouble breathing, so we're going to check out his pulmonary system and make sure there's no pulmonary edema, which can most likely be linked to altitude sickness, given a severe case. Alright, so looking at his pulmonary system, he's got a little bit of rales, it sounds like, so that's possibly indicative of pulmonary edema. Since he's having trouble breathing and his skin seems to be a little bit cyanotic, we'd want to refer him out immediately. Given the case right now, it seems like he has a severe case, so we're going to address the blurred vision as well. So all I'd have Jay do is look straight ahead. If you want to spin for me here, Jay, just to show the camera. So all I'm going to do is I'm going to take the pen light here, and I'm going to check his pupils, make sure his cranial nerves are reacting alright. Okay, so he's constricting okay, but it looks like his retina is pretty red right now, possibly indicating of a retinal hemorrhage, excuse me. The retinal hemorrhage could also be due to the high altitude and the lack of fluids that Jay has in his system right now, possibly pointing to, again, altitude sickness. Based off of his signs and symptoms of a headache, feeling fatigue, trouble sleeping, and nausea, those are the big indicators and red flags for something such as altitude sickness. Since he is having trouble staying awake in the consciousness and feels dizzy and is somewhat hallucinating, we'd be thinking about possible cerebral pathology such as cerebral edema, which is also linked to altitude sickness. In this case, these are some major red flags, and I would refer Jay out to the closest physician as soon as possible and try to get him out of the elevation and get him down to the local time to get checked out. Thank you very much.